Thank you very much, Prof. Lee, yeah. And a very good morning, Assalamualaikum, ladies and gentlemen. So, good morning. So, how are you guys? Yeah, second day of the conference, and I gathered that the first day was very exciting with our Dr. Zulkifli that came to open the ceremony. So, thank you actually for coming, for spending your weekend with us. I think it's undeniably cancer is now the problem worldwide and also in Malaysia. So today's talk may not be anything that you don't know about. I think all of you are healthcare professionals, maybe? Put up your hand. Those who are. No? The rest? I think most of you are. So I think I can very confidently say that most of you would have at any time of your journey as a healthcare profession have to be the unfortunate place of actually delivering sort of not so nice news. But I have one news for you. All of us are going to die. That is bad news. So how do you feel about that? Some of you say, oh shit, I'm only 20. What are you saying? But it's undeniable truth. All of us will be having that told to us that we are dying. Because that is how the life progression is. So we cannot avoid it. Now we are at the other end. Alhamdulillah, we give bad news to people. But one day, you and I will be the receiving end. Now we in our training always say that do things that you don't want do things that you don't want people to do to you. That means what you do to people, it should be what you yourself would do to yourself. So put that in place. When you're giving bad news, imagine yourself, you are at the other end. Maybe not now, but definitely 10, 20 years later. So how do we do it better? We cannot escape it. But can we do better? I wish I have an answer for you and me. Unfortunately, there is not a golden answer for us how to assure, how to give hope the correct way. There's no right or wrong way, actually. I need to let you go back home thinking that any way is good way provided your patient understand and actually engage with you in their journey. I think that's so important. It's never a one-person journey. As a healthcare profession, we work with patients. And I've been in healthcare professions for nearly 40 years, so you can guess my age. But that's beside the point. Yeah? But that is so important really, to engagement and to involve. So before I go further, I also would like to welcome those international participants. I know some come from China, like our chairperson. We also have speakers from China too. So welcome to Malaysia before I continue. And I hope you enjoy our lovely food especially. And our, I think our hospitality is world class. Sunway University is world class, and the hospitality is also world class. So basically, I thank the committee for inviting me to share some of my thoughts with you guys. So I would like to declare that what I share with you is the tip of the iceberg. So much there. I drown myself in it when I'm trying to catch up with it. So please, you need to actually keep yourself updated what is happening around you. And all this content has been referenced and cited appropriately. So 3 things on it. Why is it important? And I've hinted to it already. Share some of the literatures. What is policy saying about giving bad news? What is the current literature about breaking bad news? And then maybe conclude with some strategies that you and I may think about, and maybe we can discuss later. This is only 20 minutes talk. Now, this one, I'm sure you heard about it on the first day. How the cases are rising worldwide, what is happening in Malaysia. So we will have a 77% increase of cancer cases from 2023. And this is actually written down. So you can just imagine, and even our health minister, I'm sure yesterday would inform us, health is for all, that not only include NCDs. Now we are having a leading cause of death in both private and public hospitals because not of NCDs, but because of oncology cases. Because of delayed detection or late prevention. And our World Cancer Day this year actually emphasized psychological well-being. Now, breaking bad news affects us emotionally. Psychologically, we need to be able to cope with this big C or whatever bad news that we're going to deliver. And this is so, so important. So this track for communication is considered like, well, it's just good to know. But actually, no. Nowadays, we're talking about patient-centered care. Not only addressing their physical needs, like the tumor getting bigger, they're in pain. Yes, those are very important. But psychologically, if you're not well, you cannot prepare yourself to face the challenges of the cancer trajectory, disease progression. We need to be well prepared, and that is where it's highlighted. So, in a way, is bad news cancer diagnosis? Well, bad news by itself is anything that affects your life, anything that negatively, drastically affects your life. So cancer is one of the bad news. But if you ask my daughter, what's the bad news for you? My bad news will be when my boyfriend break up from me. Or my girlfriend, my best friend actually did not want to be friends with me. If you ask a teenager, that is bad news for them. So bad news can be anything really. But in healthcare, we're talking one of the most obvious is cancer diagnosis. So disclosure of cancer diagnosis is the top bad news that can be delivered to your patient. Yeah? So that's where I will come up from. Now, we also, my title said navigating cancer diagnosis conversations. So what is navigation? Basically, navigation is to navigate from one place to another. So now, when we talk about cancer conversations, we want to move that person from a shock state to a more acceptant recovery stage on how to do better in their own little life that's left. The quality of life we're talking about. So the navigating is also very important because we cannot change the diagnosis for them, unfortunately. But we can help them. We can help them to navigate from A to B. So that's where we will help them to reach whatever place they want to be. Right? So let's look back into previous report on cancer conversations or cancer journey. So I would like to go way back, and I like to refer to the United Kingdom because I'm a bit biased. I got most of my training in the UK, but I think that United Kingdom got quite a good literature on all these things. So in 1995, they already emphasized in Common Report, not that only diagnosis treatment is important, but the other most important thing is good communication. Because psychologically, your patient needs to be able to travel that journey with their family. We can address physical needs, but psychologically, that's where communications actually plays a very important part. And the NHS now come back, that's 1985. So let's come back to the most recent one, like the NHS Cancer Plan in 2005, and also the Cancer Reform Strategy in 2007, also underscore that we need training how to break the news. How do we guide and support this? We cannot get away from it. We cannot give them false hope because at the moment, unfortunately, you and I know there's no cure for it, right? We can prolong their life to be quality, but unfortunately, we are still searching for the golden cup. We still need the cure for it. Now, the recent report in 2024 talk about personalized care. They acknowledge that each person, when they navigate their journey, are very unique. It cannot be blanket rule. It cannot be what work once will work for the other, looking at their background. So that is very, very important because people tend to think, oh, that works, so let's do that, and that's it. But we need to continue to explore people's expectations. With the explosion of information, they will expect more than what 10 years ago patients expect. So their needs is so different. So they highlight personalized care, and the 2022 for both the neuroendocrine and the global CAN report for the World Cancer Care also highlight that we need to put in place better communication strategies. We need to be able to actually help them to navigate their cancer journey. What about in Malaysia? We talk so much about UK, and we are not in UK. Well, our government is also in line with it. I'm sure yesterday our health minister told Dr. Zulkifli would have talked about what is our Malaysian strategy plan on cancer care or on how to support these patients. So I would like to actually comment on the National Strategic Planning Cancer Control Program, which actually was for 5 years, 2021 to 2025. And in that 100-odd pages, it talks about screening early detection. Yes, you can screen and early detection, but the support during this detection is so important. Yes, so that is already highlighted. And also the health white paper in 2023, which has been run, they roll up this year. I think one of our eminent professor is also actually involved in this discussion about the transforming healthcare service delivery. And indeed, we cannot run away that our cancer cases are going up. We need to actually talk about how to address not only physical needs, but the emotional needs. So that is where our current status, current in Malaysia. So definitely, I think most of us will say that it's a very complex communication skills, right? You need to be able to talk to patients and need to be able to support them. So these are dealing not only with their condition, their expectations, dealing with family, right? So I'll quickly go there. Now I would like to actually share with you this video, which I pick up from, I'm afraid it's not from Malaysia context. I did try to think about doing a Malaysia context, but it's actually equally pertinent to what we're going to discuss. So it's about 5 minutes. Let me see whether it works. I did test it. Maybe we can do that. I'm worried about this. It should work. Just click it, because we did test it, right? It's only about 4.5. Yeah. Volume, it did work also. A bit louder. This one? Goes out.
So,
Maybe use that.
what's your body been telling you?
Well, I get very tired. I get some dizziness when I get overly tired. I have a lump. I'm scared. I want to know what the results of the test were.
Well, the reason we've been doing these tests, the CBC, the Comprehensive Metabolic Panel, the mammogram, let's get right down to it. Mrs. Flores, you have invasive breast cancer. It's metastatic to your lymph nodes. It's estrogen receptor positive, which is a good thing because you will respond to hormonal therapy.
What? I can't have cancer. No one in my family has cancer. Are you sure?
The next step will be for me to send you, or for you to meet with a medical oncology team and a general surgery. They will probably recommend a mastectomy, a lumpectomy, and this will be followed by radiation therapy and chemotherapy. Do you have any questions? Have I gone too fast?
Oh, I didn't understand. All I heard was breast cancer.
Yes, sorry. You have a tumor, a growth. It's serious in that it can spread and it can grow pretty quickly. So it's been very insidious. Any more questions?
How can I have breast cancer? I kept all my mammogram schedule. I kept my checkups.
So your cancer has been very insidious. It was undetectable at stage 1, and breast cancer is very prevalent in the Hispanic population. You know what I need for you to do is just to remain strong.
I have breast cancer.
Yes, I know. That's the way nature is. I think I'm just going to refer to the medical oncology team at this point. But you know, Mrs. Flores, I know you can bounce right back from this. You're very active.
Am I dying?
No, you're not dying. You have plenty of treatment options available. In fact, I'm sending you to the best medical oncologist in town. I guarantee you're gonna be fine.
I'm scared, doctor.
You know, you're gonna be fine. There's plenty of cancer survivors everywhere. In fact, my Aunt Marie, she was diagnosed with breast cancer and she is doing fine.
I don't want to be in pain like my husband was.
Like I said, you're gonna be all right. I know just how you feel.
I've seen what cancer can do to you. It eats you up. My husband died of colon cancer.
So you know what the harsh treatments that are gonna arise and the issues. You know, I'm available to help you. Why don't I set up a meeting with you in a couple of months, say 6 months?
Breast cancer.
I'm sorry, yes. You know, I'm gonna call in my nurse practitioner, Bonnie, and she'll be available to answer any questions. You can take your time. Here's some tissue if you need some. Let me go call her now. Here. Okay. I'll see you in a couple months. Bonnie.
So you can see that actually. So you can actually, from that video, there's at least 10 things that you can detect that is really wrong. But people do that. And that's not really what you and I want if we are in that situation, do we? It's really a lot of things that we can do even better. So don't worry, we have another video that shows that how it could be done better. Obviously, we do not have the answer. We cannot say you'll be totally cured, but we can help them to navigate that difficult journey, right? So we will do that in a while when we look at that. So I won't talk too much about the video because we can discuss it, but 10 minutes discussion. So let's look into, as usual, Sunday is an academic university. I have to share with you some literature. So bear with me about what the literature says about breaking bad news or having cancer diagnosis conversations, yeah? Some of the things that none of us want to hear early in Saturday morning, but it is reality. I myself recently also was informed just last week. My sister was diagnosed with cancer. Other cancer is liver cancer. It's so unexpected, but it's actually the reality out there. She's actually, bless her, 83 years old. She's been well all along. Suddenly she had internal bleeding after a fall. And then they found that her cancer, she actually got cancer and it burst. That was literally last week. So you'll find that at some time, you're young, but at some time, you will find that there's a lot of things happening that is actually related to cancer, unfortunately. So what does literature say? So I have a few literatures, but I actually, if you look at it, it's quite dated, it's 2016, but I actually deliberately choose this because I want to highlight that we have been talking about it nearly 10 years ago already, but we're still talking about it and still improving on it. Because it's a skill that is so patient-centered. Each of us, even though our hair is black, our eyes is brown, we have the same different needs, depending on your culture, religious belief. Now, the Chinese will say that cancer is soy. Aiyo, you must have done something bad in your past life, right? That's why you get punished, the old people. And it does exist still, this type of talk, which is not helpful at all. You know, if I don't get depressed, also I'll get depressed. You know, think about what did I did wrong the previous life that I get punished this year, this life. It's seen as a punishment. Whereas, if you look at the Muslim, it's God's will. Now, if it's God's will, it's something we accept, we rather, because God's got better plan for us. So you find that even culturally, we have different actually viewpoint and acceptance, and that is so important when we talk to them about how do they navigate their journey. We must understand their background. It's not for us to judge, to say that, "Ayo, you're so stupid lah. They got last life and this life. This is just an abnormal cell multiplication." Right? So we have to actually put ourselves in that context. So what does actually the communication in cancer care has already actually emphasized that the importance of communication, the importance of having an effective dialogue, which is actually centered to the patient background. And that actually will improve not only the satisfaction, but actually promote faster recovery. Because all of us now know that to recover doesn't mean only physical. You have to recover psychologically. If you're very depressed, obviously your immune system will be right down. Always know that. So to actually make people psychologically accepting, of course nobody wants to have cancer, but we have to get on with life. And that actually had proven since 2000, or like you see my data, 2013, 2016, 2018, consistently have said that we need to communicate. We need to actually give very clear information. And the complaint library, as usual, evidence-based. The latest one was, unfortunately, 2018, actually emphasized that we, as the healthcare professions, need to be trained how to actually support the patient, how to navigate their journey. It's not something that you can read from books, actually. It's from your experience and from your own feelings and your empathy. So they actually highlight that, and they actually look into quite a number of studies that look into, I think, 11 systematic review that emphasize the importance of actually giving communication skills training to our nurses, to our doctors, to healthcare professions. Now you and I know I'm a nurse and I'm a midwife. I'm proud to be that. But our communication credit is only 2 credits. It doesn't really prepare me. It doesn't prepare anybody, actually. Let's put it that way. How do you tell a 20-odd-year-old person that they have cancer? They're not even married or have enjoyed life yet. So it's something that we have to learn on the job, some of it, and continuously learning. And the systematic review actually proven that the skills training actually do help to empathize more. So you and I just need to have continuous training, basically, right? So it confirmed that. And how to break bad news. That's always been in a communication module, how to break bad news, but only 2 hours, maybe, or 3 hours in that module. Equally for the medical training or the nursing training. And they are the main healthcare providers to this group of people. So this is where how to break. This one was actually recent in 2023 by the International Journal of Gynecological Cancer. And they actually do a survey among nearly over 1,000 participants from 3 main countries, which is Australia, Germany, and Switzerland. Maybe we should do one because Asian culture is slightly different, right? So these are very westernized, I would say, progressed country. They still find that they have problem when they actually converse during bad news. They actually survey the healthcare professionals and also the medical student. Unfortunately, no nurses or other healthcare professions was included. Maybe this is something that we could do research on. Yeah? And it's so important with the rising cancer. I'm sure yesterday you were talk about we are actually facing problem in our incidents. It is catching up, unfortunately, to our number 1 NCDs cases. So this actually, you can easily get this. So basically, it actually emphasizes the importance of actually providing training where they want to do about doing bad news. So basically, I would also bring you back, since we talk about the need for communication training, some of the fundamental skills that you can choose is ask, tech, us. I think that was so easy. Right, 5 minutes, sure. So when we ask the patient, we get their perspective first. Never from yours, because who is having the problem, you or them? It's them. So they should actually control. They should tell you what they feel, what they need to know. Then we can then tackle what, because each your patient is different. Some may be asking a question about their family. What's going to happen to my children? Some may ask about what happened to my husband then. So there's different needs that we need to find out, and then when we tell them whatever information we can or we can find out, we must ask again, do they understand? Do they need more? It's not a one direction, right? It's very circular. And when you say, tell me more or ask them to, any other questions, there's actually 3 levels of conversations that you look at. Now, I'm not going to give you communication module, tell you how you communicate. I think this emphasizes the communication skills that each one of us need to improve on. And it is actually ongoing. It changes as we go along, right? So, plain language, I could not emphasize more. We tend to use a lot of our medical jargon, right? It's so important that we need to simplify. We need to think, do they understand? Do we make them more scared with all bombastic words? We are not supposed to make them more scared. But we do that because we're so used to the technology. So we have always to remind, we're talking to laymen, right? So we ask to respond to the emotion. Obviously, people will be shocked. People will be in denial. We know about Kubler-Ross theory of grieving. They'll be defensive. Why me? I'm a vegetarian. I don't eat this. I don't eat that. I don't eat meat. You're wrong. So we need to actually be able to respond it. And as I use nurse, and I thought that was so appropriate. I'm a nurse. I'm a die-hard nurse. And Prof said that. So in the nurse itself, you actually can do the MURSE. So I won't go through all of this, but you'll get my notes. Yeah, so I'll just go through that. Fundamental skills to avoid. Those are skills that you need to, what I said, to ask and then to answer and to ask again. But these are things that you need to avoid, like lecturing them, giving them a lecture about what is the cancer all about, blocking their questions and then responding differently. And these are things that not to give reassurance too fast. False hope. That's very, very, very scary if you give them false hope, right? So those are some of the very dated, I must confess, 1996. But what I want to share is that it actually begins even back then. That conversations, how you talk, is so important. And the key communication task is always see them as a person. Each person got different needs, different history, and their age group also denote the level of needs of communication they need. Right? The younger one will actually want to have more information. The older one might say that, well, I'm going to die anyway. I'm 80 years old, like my sister said. She's not interested in whatever information I want to give her. She just said, I'm going to die anyway. Just let me rest in peace, she will say. Yeah? So it's actually rest in peace is how do we comfort them? Palliative care. Yeah? So the next few slides is actually sharing with you again some literatures that talk about complications, about how do we actually facilitate complication, because during your, your interaction, there's a lot of exchange information. So this is one of the systematic review that was actually quite predominantly, they just look at systematic review, and they actually highlighted certain things that I will encourage you to have a look. It's actually open access, so you easily can get it. Yeah? Okay, this is the last video. I will actually, because I'm running out of time. This is the better communication. Okay, just now was, as you can see, I can identify easily 10 things that I hope I would not do. Okay, maybe. No. As usual, when you test it, it works, and then different computer. Then go to my second video. Go to my spot. Then you doing it when you close this one. You open the show. Then go to my
Hello, Mrs. Flores. How are you? So I've scheduled this meeting for us today to discuss the results of the breast biopsy, but I've actually given my pager and my cell phone to my nurse practitioner so that we don't get interrupted. Are you alone or did you come with someone?
No, my children had to work today, so I'm by myself.
Okay. So how are you doing?
I still get tired and I get dizzy if I get too tired. I've got some knee problems and yesterday I had some nausea. Better today. I think it's probably mostly because of the blood count, the anemia. So I think I'm okay.
How about any anxiety or depression?
Well, I'm really worried about the test. I have a lump, so I'm afraid. I don't know about that test they do with the needle.
Have these symptoms affected your life in general, your ability to complete your housework?
Well, I've cut back my volunteering at the nursing home, but I still babysit my grandchildren.
Okay, so my clinic and I can help you with all those symptoms. We'll go over that, at the end of this meeting and in the next couple of weeks. Before we go over the results of the breast biopsy, I would like to ask you one more question. How do you handle medical knowledge? Would you like all the details of your treatment? In my family, my mother would defer to her children, especially me. How do you handle medical knowledge?
Oh, you'll have to tell me. I want to know everything.
Okay, all right. So, Mrs. Flores, I'm afraid I don't have very good news for you today. The breast biopsy revealed that you have an invasive form of breast cancer. I'm sorry. I wish I had better news for you.
How can I have breast cancer? I make all my checkups. I have all my mammograms. I don't understand.
Unfortunately, despite routine checkups, cancer can occur in anyone.
How long have I had it?
It's very hard to tell, but you probably have had this for several months.
No one in my family has ever had cancer, except my husband. Could I have caught it from him?
No, cancer is not like a cold. It's uncertain why some people get cancer and others don't. Tell me about your husband.
He died of colon cancer. I nursed him.
Sorry to hear that.
So, I've seen how cancer can eat you up. It's ugly.
I know this comes as a shock to you.
I don't want to be in pain like he was.
My clinic and I, we're going to support you through this. And we're going to guarantee that we address your pain and all the symptoms that you're having. We're also going to be available for your family. Okay? I'm glad you told me how you're feeling, because now I know where you're coming from. The next step is for you to be meeting with a medical oncologist. This is the cancer doctor and the general surgeon. Most likely they'll recommend the following. Either to remove part or your entire breast. The goal of this surgery is to remove the cancer. This is going to be followed by radiation therapy and keep.
Okay, I cut it short because I know we don't have time. There is about another 3 minutes to it. Yeah, thank you so much. Okay, thanks a lot, Miss. Okay, so you can see that there's a better way of actually delivering conversations. But however, I will confess the video just now has been cut halfway because there's a bit more to it. But I hope you get the gist of it. It's actually how you actually address your patient needs and how you actually look at the level the patient is in. So there has been a lot of protocols or steps or processes that people actually put in the literature to guide us when we actually have to deliver in that position, deliver the bad news. So basically one of it is so common is the spikes. Now I won't go through it because I think most of you, at least 50%, would have heard of it if you're in the cancer arena, because that's where you need to break news. So these are very simple about the setting, about the perception, about how you invite people to share their own experience. Like just now the video, when the lady actually says that her husband got cancer of the colon, she actually paused and asked her to share her experience when her husband have cancer. So you actually do invite, so to talk about it, so that they can remind themselves that that is the journey that I will have to go through. All right, and also sharing the warning that giving them what the whole condition is going to be about, and also pausing and waiting for them to continue. You can see there is a lot of pause, letting them digest the news. Right? So I won't go through this, and I think you can actually find it very easily in most of the one. The other one is also by Robert and Macfield, which actually talk about ABCDE. So instead of spikes, you can use ABCDE. And it's actually very self-explanatory. Basically, advanced preparation, make sure you ask your patient whether they want anybody to be with them or not. Right? It's so important to prepare the setting so that they're all emotionally actually ready. Okay? So those are some of the other way. The other one is a comfort model. You can get it from the website. It is a bit about, actually basically, is the same thing. You need to connect, you need to build relationship, you need to wait and listen from them. You need to give them time. So I don't think there's anything new for those who are already in oncology nursing or in oncology care. So my last, because I'm eating to other people, speakers one, is that the way we communicate, it's considered bad news, I think is actually very important, and it can affect the patient experience. They cannot run away their cancer, but can we do something to help them? I think that's something that we have to bear in mind, and that is what we as healthcare professionals are there for. We may not have the cure, but that doesn't mean that we can't help them through that difficult journey. And communication is not only about words. The non-communication touch, the tone of your voice, the pausing, giving them the opportunity to ventilate their feelings and accepting their thoughts. Those things cannot be written black and white. Right? So communication is not only about words. And breaking bad news is never easy. I always say, it's a pit of any medical or nursing practice. We want to give good news. We don't want to be the angel of death, right? Always want to give good news so that we can be happy, we can celebrate, but we cannot deny life has to come to an end. But we can do it better, right? So I thank you for your attention, and I hope to elicit some questions and answer time. Maybe we can talk about it. It's a topic that there's no answer for it, I'm afraid. I wish I do have the answer. Maybe then we can win the prize for it, but there's no answer. It's very individual. So thank you very much, ladies and gentlemen. I will come back to you guys during discussion, and I'll pass back to the chairperson to continue. Thank you.